The blood vessels can round out our series on the cardiovascular system. I've already gone through blood, gone through the heart. It's time to cover the blood vessels. Now, the blood vessels themselves are going to be your delivery system. They're meant to take your blood from the heart to every tissue in your body almost. There are a few exceptions. Think back to cartilage, for example. But they're going to almost every tissue in your body and then bringing that blood back to the heart. You're distributing gases, things like oxygen, that pick up carbon dioxide. You're having nutrients. You're having waste products, ions. Everything is traveling the blood here. There's so much traveling at any one given moment. So the first thing to look at is what are the three kind of main categories? Arteries are the first. Now, arteries always carry blood away from the heart. That's your one true statement about all arteries. Doesn't matter if it's arteries, arterioles, large and small, they always go away from the heart. Now, they're usually oxygen rich. I say usually because there is an exception to the rule. The pulmonary circulation and the umbilical circulation end up not being oxygen-rich arteries. So in these cases, there's a little bit of a switcheroo almost going on, where you've switched to oxygen-poor arteries. So we have, looking at the arteries, always going away from the heart, usually they're oxygen-rich. Capillaries. Think of these kind of as the middlemen. They're the ones that are in between the arteries and the veins. The capillaries are going to allow for gas exchange, for nutrient exchange, for ion exchange. Basically, this is where you'll exchange whatever is in the blood with the tissues they come into contact with. The capillaries are usually 1 cell layer thick, so they're very, very thin, allowing great for diffusion and absorption of materials in and out of the capillaries. Veins. We're on the flip side now. We're coming back towards the heart. Because you can say that every vein always carries blood towards the heart. So every vein carries blood towards the heart. Well, most veins are oxygen poor. They're not all. The exception again, same thing, pulmonary and umbilical. So the same two exceptions that you saw in the arteries. And we'll get into why that happens in a second. But just think about, at this point, the true statements. Arteries always away from the heart. Veins always towards the heart. So if you're always thinking arteries are red, veins are blue, not always. There's these exceptions, the pulmonary circuit and fetal circulation. In those two cases, those exceptions, your artery would be blue. Your vein would be red. So the true statement here is arteries always away from the heart, veins always towards the heart. Arteries are usually oxygen-rich. Veins are usually oxygen-poor. When you start looking at this diagram, you can notice there's the pulmonary circuit up top. That is your pulmonary circuit. Now, a lot of times we'll discuss the pulmonary circuit separate from the systemic circuit. Because systemic circuit, you notice, is going to be everything else besides the lungs. So if we're focusing on the pulmonary circuit, notice, because we've already talked about the heart, we know that the right ventricle of the heart is going to be pumping blood out to the pulmonary trunk and the pulmonary arteries. This part is showing you the pulmonary trunk and pulmonary arteries. It's blue, but it's an artery. Artery because it's going away from the heart. Blue because it's pumping the blood towards the lungs. It hasn't picked up all the extra oxygen yet. But take the flip side. That's the pulmonary veins. They're red because veins always go back to the heart. But in this case, it's taking the oxygen-rich blood from the lungs and heading back into the heart, so it can pump out to the rest of the body. So the systemic circuit, though, is this whole part here. That's basically showing every artery, arterial that goes to every organ in your body except the lungs. The lungs are the pulmonary. So we're going from head to toes, from digestive to urinary to muscular to skeletal, everything. That's your systemic circuit. Now, once they get there, this area in the middle is symbolic of all the capillaries. That's what's actually allowing for the exchange at the tissues. You'll notice it's purple because, well, as you transition from red to blue, it's purple in between. That's kind of the change in the color there. The purple is saying that, hey, we're not as full of oxygen as the arteries, but we're not as low in oxygen as the veins. So we're kind of in between. We're in that exchanging area. And then the flip side over here is all of the veins and venules. Their goal is to bring the blood back up to the heart. So they're basically allowing the blood to flow back to the heart. So it doesn't matter if it's the pulmonary or if it's the systemic circuit. You always have the arteries, capillaries, veins as your complete circuit because they always start the heart, goes out, and comes back to the heart. It's one full circuit around. Now start looking at what makes up these vessels. The arteries, the veins, they're made up of three main tunics. Now, a tunic is a layer. There's the tunica intima. This tunica intima is the most internal of the three tunics. It's the one that the blood actually touches. It's the inside lining. And that inside lining is endothelium. Think back to AP1 histology. Endothelium was simple squamous epithelial tissue. So flat, smooth cells, making it so the blood doesn't have a place to stick. So you're going to have that endothelium lining all the way around the lumen or the inside of your blood vessel. Now, if the vessels are larger than 1 millimeter, then you're going to have this subendothelial connective layer. Basically, it helps you get more support, more structure there. Because the bigger the vessel gets, you've got to add extra structural support to make sure it doesn't collapse. So this is the tunica intima, the inside. The tunica media is going to be the middle tunic, the one that's in between. It's going to be primarily filled with smooth muscle. The smooth muscle is meant to contract, to squeeze. That's vasoconstriction. But when it relaxes, it opens up. That stretch is where the elastin helps in. So it's this combination of smooth muscle and elastin that allows for vasoconstriction and vasodilation, allowing the vessel to open and close. Now, that opening and closing helps with regulation of blood pressure. We'll get to that later on in the section. But there is also this sympathetic vasomotor nerve. That nerve is what's helping control that vasoconstriction and vasodilation. Now, this sympathetic nerve control is basically being tied back into the central nervous system based on how your blood pressure is reacting. So that's all coming back to the physiology we'll get to later in this chapter. So keep this in mind. We'll come back to this in the physiology section. Now the tunica externa. This is the outside layer. The tunica externa is going to be filled with collagen fibers. Well, if it's the externa, it's the outside, the collagen fibers give strength and structure, give support. Helps make sure this vessel doesn't get pushed too large. The blood pressure doesn't expand it too much. Helps keep it at a certain size. But some of the larger vessels, again, over that 1 millimeter, has what's called a vasovisorium. Now, the reason this would have a vasovisorium is because it needs extra blood. So the larger it is, the thicker it gets, the blood simply can't diffuse enough through. So you actually get little blood vessels inside the walls of the large blood vessel. And I'll show a picture of that in a second. But the idea here is you're still providing the nutrients and gases to this living tissue because the blood simply can't diffuse through the thickness of all the layers. So we're looking at the tunica externa. So here's a picture of an artery and a vein, the three tunics. You still have all three tunics present in both arteries and veins, but there's different composition because they have different functions. Arteries are typically a higher pressure system. Veins are typically a lower pressure system. which means when you look at the tunica media on both, you'll notice that the artery ones are usually a little bit thicker because they need more strength and support to push and keep that blood pressure. But both of them can have the vasa vasorum. If they're large vessels, they need support, they need nutrients. But then you also get a second specialized structure out there. You get that nervi vasorum. There it is. The nervi vasorum, basically nerves, controls. You help to control and basically allow input into the vessel. So you're looking at the three different tunics here. From the tunica intima, the inside, the tunica media, which is this whole chunk here and this piece, and then the tunica externa, which is all that collagen fiber outside. So three tunics found on both the arteries and veins. So a little bit about the basic structurality of your actual vessels. From the arteries, the capillaries, the veins, there's a whole lot more we need to get into.